Thank you very much, AHMP, for giving us this stage. So, I'll keep my presentation very short and sweet. It is just 5 slides, and I'm going to talk about hospital internal marketing, how we can leverage our internal environment, internal sources inside the hospital for the marketing. And at end of this session, at last slide, I will keep it what is missing in our system, which I have observed after 6 years working in as a hospital operations, and now as a tech entrepreneur, I have changed my mindset from uh, operations to the entrepreneurial, and I have learned few things and find some of the gaps which we can implement to moving forward in this tech era. We all know marketing is, but I keep it to make it fundamentally to remind all of us that what is marketing. Marketing is about connecting with consumers and convey your product features. This is what marketing is. We all are doing the same thing, conveying the features, specialities, what all are services we are providing, right? So it is not about revenue, it is about reach. So please make a note of it. Most of the time, as a team, we are more focused about revenue, sales, what is the business opportunity, etc. And we forget about to reach out to our audience, reach out to our actual consumers. So marketing elements. So there are 5 elements we should focus on in terms of internal marketing, external. Whenever we see the marketing elements are same. One is identify pain points. Second, create awareness. Third, target audience engagement. Fourth is consumer tractions. And fifth is generate sales lead. The last point I have mentioned, sales lead. So I believe the marketing person's job is just to generate a sales lead, not to convert the sales. Let the sales guy to do this. I know it is confusing because in our system, in our hospital environment, we have seen marketing is doing the sales, and that's come the problem lies. The person who has a marketing ability, it is not necessary he has a sales skill. And we always ask a marketing guy a wrong question: how much revenue you got, right? But that's the sales guy's job, na? That's not the marketing guy need to do. He need to focus on how can creatively I can connect to the audience. Let him connect to the audience, take a sales lead and give it to the sales guy. And the salesperson will close the sales. He will provide the post sales support service, whatever the things, let him do it. So this is the basic fundamental elements we must focus on, whether it is internal marketing, whether it is external marketing. Fundamental elements are same. So now let us understand healthcare. Majority of us know the healthcare is by most of the time healthcare we mean about hospital and doctors and patients. It is not at all. Healthcare means when we are trying to identify a health problem, provide a solution, and continue efforts to maintain the elements of health. Elements of health here is the complete state of physical, mental, and social well-being, which is a WHO given this definition in 1980s. It is still relevant. Majority of us, we all focus on providing the services. Doctors are focusing on diagnosis, etc. But in today's era, it is more relevant if you can solve the problem, not necessarily providing a medicine or treatment or surgery. It can just counseling can also solve your patient's problem, but it will convert the future sales. So it is not only about hospitals and doctors. Now, internal marketing opportunities. If we go through our hospital entire to and fro, you will get many marketing opportunities, but most of these I've mentioned for marketing opportunities, which is first is OPD waiting area. We are doing display marketing. We are putting uh, patient leaflets, educational pamphlets, right? This is internal marketing. Now, we need to identify there are creative ways in OPD waiting area how you can do it. Second is inpatient engagement programs. How can you engage inpatients? There are planned surgery patients who are mobile in a hospital, right? So you need to find some engagement programs. There are patient relative interactions also where you can do internal marketing, because if in your hospital there are 100 patients or 50 patients are admitted, at least one or two people will be accompanying with him, right? So entire day, what are going to they do with? They are just roaming around in your hospital. So rather than doing some non-productive things, right, you should think about engaging them in some activities. And fourth part is which I've learned in my entrepreneurial journey, which I would like to share to all the doctors and marketers here: specialty and department elevator pitch. Most of doctors are lacking in their elevator pitch. Elevator pitch means one of my friend, they are neonatologist in Rajkot, and I observed in their practice. Every patient they come to their chamber, they first explain what exactly the neonatology is. I mean to say, they inform that we are four neonatologists in our team. Round the clock, there is one neonatologist is available in NICU, and as a neonatologist, we treat up to 6 months of patients, up to 6 months of child. This is what their elevator pitch. Whether that person is a doctor or is a PhD holder or is a non-educated, or a layman, whatever it is, but their elevator pitch doesn't change. Even they repeat it to their follow-up patients also, because it has to clear to each and every patient, their relatives, about the specialty they work. It is also very much relevant for your departments also. If your department, your radiology department is having a 3 Tesla MRI, every person visiting to that department must know that this is a 3 Tesla MRI machine, and there are only 4 MRI such machines or only 2 MRI machines in the city, and one of it is here in your hospital. You must convey this to each and every patient. And similarly, there are many such equipments you must have in your department, but our department fellow is not maybe conveying the same to every patient. So include it in your communication. And this is the last slide. What is missing our system? As I have earlier mentioned, that please restructure our marketing department structure. If possible, I suggest keep a marketing team and a sales team different. You will get a better result. At least for the pilot project, you can do an experiment and and do some analysis whether you are getting different result or not. Second is we'll talk about the inpatient engagement and patient relative engagement, right? In so many of the hospitals, they are also having patient engagement officers, but they are part of a administration team. They are not in the marketing team, which is again a problem. So if we believe that the engagement is a marketing job, we must include them into the marketing team. Also, the hardcore marketing mindset, move out of the sales mindset and a sales KPI. And third part is lack of involvement of stakeholders. So we need to involve doctors, nurses, pharmacists. There are also nurses who are good in creating reels and videos, right? You need to involve them in your marketing team, marketing department, give them incentives. Thank you.
Thank you, sir. Thank you.